Hello, I'm William McLean with the WAFF 48 Digital Team. I'm joined today by Cleet Wetley from Huntsville Recovery. Cleet, thanks for joining us.
Hey, thanks for having us. This is a really important issue.
We're talking about the opioid crisis here in the United States, and we actually have some pretty sobering statistics. The National Institute on Drug Abuse states that 115 Americans die every day due to overdosing on opioids. I know your business, Huntsville Recovery, works closely with these type of cases here in the Tennessee Valley, and are those high statistics matching what you're seeing in our area?
Absolutely. We're the largest clinic of our kind in the state of Alabama. Our patient population is about 850 to 900 people that are receiving medication-assisted treatment for opioid dependence. And we're also seeing a lot of other problems right now in terms of people that are taking fentanyl and other types of opioids on the streets. And what people don't realize is that, when they're addicted to these substances, that if they take a benzodiazepine, for example, they can die of respiratory failure. So we're seeing really an influx of people that need help right now.
Opioids have been in the news constantly, it feels like, for the past few years. Explain to someone who maybe this hasn't impacted their lives yet, how do victims of opioid abuse get on that track? Where does it start?
Well, I think a lot of times people end up taking painkillers that are prescribed to them legitimately, but they continue to take them and they don't realize how quickly they can become addicted to an opioid. Part of it was misinformation that came out a long time ago from certain pharmaceutical companies, and they basically said that opioids were not addictive, so doctors just began prescribing them like crazy. And so I think right now people don't realize the dangers of opioids, but because this has become a national public health emergency, more and more people are starting to understand the real danger.
Right, and there's dangers with opioid overdoses, and as you were saying with fentanyl and even heroin, that can lead to what many would see as even more aggressive drugs, kind of a gateway to those.
Well, the thing is that we have a lot of drugs on our streets right now. Right now, opioids are getting all the attention, but we still have huge problems with people manufacturing and distributing methamphetamine. And also, too, in the state of Alabama, whether folks like it or not, marijuana is still illegal. And so, we see a lot of substance abuse in our community. And one of the things we want to do at Huntsville Recovery is make sure that people have treatment options.
So talk about those treatment options. If I'm someone that's maybe having issues with that, or if I know someone in my family, a friend, and I want to be able to start looking at options for getting them help, what all do you provide at Huntsville Recovery?
Well, at Huntsville Recovery, first of all, we've got a full-time doctor. We also have a team of nurses. And what we do is we do a biopsychosocial assessment. That's just a fancy term for figuring out what exactly is going on with that individual. Once we have that person assessed, then we would recommend an appropriate level of care for them. At Huntsville Recovery, we've got medication-assisted treatment for people that are addicted to opioids, but we also have, and it's brand new, by the way, we have an intensive outpatient program, and we also have an outpatient detoxification program. And soon we're going to offer other levels of care as well, so that people, once they are done going through a recovery program, they can still get the aftercare that they need. We also offer a free service called Smart Recovery, which is a peer support group, but led by a trained facilitator.
Understood. Talk a little about the medicated assisted recovery. I know some folks, they hear that, and they might be dealing with an opioid, prescription problem.
Sure.
So just kind of walk us through what that looks like and how it's different.
Yeah, when we talk about medication assisted treatment, often we're talking about drugs like methadone and also buprenorphine, sometimes also known as Suboxone or Subutex. And what those do is they prevent a person from going into withdrawal, but they also don't get that person high. So methadone has really been shown to be the most effective treatment, but unfortunately it's very, very stigmatized. A lot of people say it's replacing one drug for another. But what we found is that people that are on methadone treatment and going to counseling, they're no longer out there committing crimes. They have to have a stable job. It's not cheap, so to speak. The medication is expensive. But they have an individualized treatment plan, and often they're meeting those treatment goals. So methadone is highly effective, and so is Suboxone. But like with all recovery programs, they work if people do what they're supposed to do and also get the counseling that they need and have an individualized treatment plan that helps them set and achieve the goals.
Sure, and you've mentioned plans and programs. When we're talking about expectations, this is something that takes some time to be able to get true results. Is that true?
Absolutely. I think part of the problem we have when we talk about substance abuse treatment and it's an American problem, is we always want an instant fix. And we're not going to get that instant fix. People are messy, so to speak, and they have a lot of issues. There are reasons that people end up addicted to painkillers and opioids and other types of illegal drugs. So one of the things we want to do is make sure that we take the time and offer people the right solutions for them.
Now, Huntsville Recovery, you guys have a series of treatments for all types of different, disorders, diseases. Talk about some of the other offerings you guys are doing.
Well, again, with the intensive outpatient, that's a phenomenal program. It's modeled after the Substance Abuse and Mental Health Administration's Matrix program. It was originally designed for people with stimulant use disorder, but they found it worked for all types of addiction. So this is an evidence-based program, and it is very intense. It's like boot camp for addiction, so to speak. So it's 9+ hours a week of intensive therapy to help people change their lives and make better decisions about what they're doing. Also, with the outpatient detox, that's not so much treatment the way we traditionally think about it, but that is a program that allows people to get sober and get stable so that they can enter treatment, whether it's residential or outpatient.
Cleet, a lot of great information. Right now on your screen, you see some information on how to get in touch with Huntsville Recovery. Whether you're having a crisis you're going through, if you know someone, a family member, a friend, definitely encourage you to reach out, get some information, and learn about the options that you do have to get the help that you or your friend might need. Cleet, thank you again so much for joining us today.
Thank you very much for having me.